with the Association of Hawaiian Civic Club. And we welcome all of you to join us for this little talk story. CJ will be facilitating most of the discussion this evening. Please have questions for you. He'll do his presentation and we'll leave time at the end of his presentation for questions from all of you. We'd like to hear your concerns and your issues wherever you're at. And I did remind CJ, we may get some out-of-state viewers as well, so to be prepared. So CJ, you want to introduce yourself to the rest of our membership of Civic Clubs, please?
You bet. And I'm going to actually share my screen. So give me 1 second to get it going here. Oops, hold on 1 second, sorry. There we go.
Hey, Ua.
Aloha.
Aloha. Ua, CJ propped up the screen to contact. They've done great work in some of the Micronesian translations. So I wondered if you might incorporate that on PIP's website so that our FSM folks can connect with the resources available.
Yes, absolutely. CJ's been busy.
Yep.
Okay, I am ready now if you guys are ready for me.
Go ahead. CJ,
Okay, thank you.
introduce yourself to the rest of our members.
Fantastic. So my name is CJ Johnson. I work for the COVID-19 Outreach and Public Health Education Project at the Hawaii State Department of Health. My normal day job at the Department of Health is in the Chronic Disease Prevention and Health Promotion Division. So we work on things like diabetes and heart disease and COPD. And we were asked, you may have heard, it's not a surprise, around last fall there were some changes at the Department of Health, some things that some leadership changes and some structural changes. And a lot of that had to do with the fact that there was I think an acknowledgement that the department could do a better job of specifically of some of the contact tracing things, but also sort of our outreach, right? And our collaboration and our cooperation with our community partners. And so I was brought in, there's a couple of us in my department that were brought in because obviously so much of the impact of COVID-19 is similar and overlapping populations to the populations that are disparately burdened with COPD and diabetes and heart disease. And a lot of that has to do with structural challenges and racial challenges. And so we really wanted to make sure that we were engaged with the community and getting information out about COVID and about now in the last month or so about the vaccine in a way that was accessible and resonant and in, as necessary, language appropriate, and meeting people where they lived and working with community leaders. What we found out really quickly when we started doing the work was that in the absence of a really hands-on approach from the department, a lot of organizations had kind of stood up and in particular, I want to shout out to Papa Ololokahi and the work that they did in founding the 3R Coalition, which is the Recovery, Response, and Resiliency. Is that right?
Yes.
Yeah, and they did this amazing work of getting together, I think 40 some organizations that serve Native Hawaiian Pacific Islander population in Hawaii and providing and organizing around policy and around communications and around data and really, really working hard to serve the community's needs. And so the first thing that we did was reach out to them and try to figure out, rather than duplicating work or trying to co-opt the work that was happening, our goal really was to listen and to figure out how we could support the leaders and the work that was already being done at this organic grassroots level. And it's been a huge learning opportunity. We still have so much to do. There's some of the structural challenges and barriers are generational. But we've really had a wonderful experience of trying to create a better pipeline, and I think it's a dialogue, right? A better pipeline for coordination with Papa and with the other organizations that are working on the ground. And part of that is we have a really robust library of multilingual resources. If anybody's interested, if anybody works with PI communities, we have a great resource library. We actually just added Olelo FAQ to our website. I just shared that in the chat earlier. We have been doing events like this. We actually, another thing in addition to my getting involved was the contact tracing team added a dedicated NHPI contact tracing group. So I was just told yesterday, there's 19 people now working on that group that have language skills, cultural connections to NHPI populations around Hawaii that are doing the contact tracing. And in addition to just doing the contact tracing, they are actually working with folks to provide wraparound services like housing concerns and PPE concerns and stuff like that. So there's been a ton of work. I'm really, really proud. The DOH, we continue to struggle in some ways, but we've done a ton, and we're really excited to continue to be supportive partners. When we reached out to when we realized that we were going to need to reach out and make sure that everyone had good information about the vaccine, when you have a large population and you want to get a lot of information about what they're thinking quickly, you do a survey, and we put out a survey to the general public, and some of you may have taken the survey. That was a lot of questions about, like, on a scale of 1 to 10, how likely are you to take the vaccine when it's available? But we wanted to have what I call a series of talk stories with community leaders and influencers and folks that are connected and have a pulse of their community to figure out what your understanding of the challenges and the concerns and the fears are about the vaccine, so that we can integrate those and respond to them in our communication. So what I wanted to do, and we've been doing this for a good month now, is reaching out and having these kind of intimate talk stories, right? These are not huge webinars, which I've also been doing big, huge webinars, but these are intended to be smaller, more intimate conversations where I'm going to spend a few minutes. I've got about maybe a 20-25 minute deck. And then after that, what I'd really like to hear is your questions and concerns and input about how we can increase our outreach and how we can do an even better job of reaching out to the Native Hawaiian population, Pacific Islander population, and meet folks where they live. And what I really want to make sure I'm clear about is I'm not here to do a hard sell. Like, it's not my goal to browbeat anybody into saying, like, yeah, we're going to go get vaccinated tomorrow. It's totally normal. It's totally reasonable that people have concerns. I think what we want to make sure we do is provide good information and accurate scientific information, and make sure that folks are discerning between the good stuff and some of the rumors and some of the bad information that's out there. And then people can make informed decisions. That's all we're here for, right? Is to help make folks make informed decisions and help make you as community leaders, who are a trusted resource already, we assume, be able to answer the questions that people have. So I want to share up front another thing, that this is changing really quickly. The first month I did this, I was doing it like 4 or 5 times a week, and I didn't give the same presentation twice. It was like, we think there's going to be 2 vaccines. One of them just got approved. Now 2 of them are approved. Now there's a 3rd one that they're talking about. We don't have a plan, but we're going to have a plan, and we're doing this and we're doing that. And so everything is changing really, really, really quickly. And there's a lot that is in flux, and there's a lot of questions that we don't know great answers to yet. And I apologize in advance. There will be times when I have to say, we just don't know. And that's a combination of the scientists who are studying the vaccine and studying the disease. It hasn't been around long enough for some of these answers, and some of it on the operational side. What is the DOH doing? What are our partners in these setting up clinics doing? Some of that stuff is emergent as well. And so if I say I don't know, we're working really, really hard to provide up to date. I'm in calls multiple times a week, getting the most current information, and I want to make sure that it gets out there. But we also know that we don't want bad information getting out there. As an example, originally maybe masks weren't as big of a deal, and we said, don't worry about it. It doesn't matter if you're in the public. And it turned out that masks actually were kind of a big deal. So then you got to walk it back and change your thing. So we're really trying to avoid saying anything misleading or incorrect. So bear with me on that. But I think I have a lot of good information here I want to share. If people have questions, feel free to enter them in the chat as we go. And then, like I said, my presentation's not very long, and I'm available till as late as 7. If people want to hang out and keep talking, I could even go later than that. So without any further kind of background, I'm just going to talk about, I think, what we're all here tonight to talk about, which is the big topic, is vaccines. Obviously, vaccines are a huge, huge important topic. They're key to stopping the pandemic, to saving lives, and to getting back to normal life, right? Without a vaccine, we're going to be stuck in this sort of limbo that we've been in for a really long time. But what is a vaccine? I think this point of clarity, a vaccine is a kind of medicine that helps the body protect itself against a disease. It's like a shield, right? A vaccine is like a shield to help prevent illness. It's not, and I think this is the important thing, vaccines aren't a cure. They won't help a person who has a disease recover. They won't reduce your symptoms if you have symptoms, but they will greatly reduce the chance that a person will get sick if they get exposed to the disease. Right now, you may have heard some of this. There are 2 COVID vaccines that are approved for use. They are made by Pfizer, BioNTech, and Moderna. At this time, those are the only approved vaccines that will protect against COVID-19. There are others that are being studied. There's a Johnson & Johnson vaccine. There's the AstraZeneca vaccine. There's others that may come. All of that happening may change all of this timeline information entirely, right? If we have another supply, that will affect a lot of what I'm talking about. But for now, what I'm going to be talking about when I talk about a vaccine is these 2 vaccines. Most of the vaccines currently available or being studied need 2 shots to be effective. The Pfizer BioNTech requires 3 weeks between shots, and the Moderna requires 4 weeks between shots. And when you get your first shot, you will be told when to come back and get your second shot. They're giving out cards. You've maybe even seen those cards. So both of these vaccines are a new type of vaccine called mRNA vaccines. You may have heard a lot of talk about that too. Conventional vaccines use a dead or an inactive germ to train your body how to fight the actual disease. But an mRNA vaccine shares instructions to teach the body how to fight those germs without injecting the actual germ. It's more like a photograph or like a wanted poster, right? It shows your body what the disease looks like to help recognize it without actually putting the germ in you. So to that end, mRNA vaccines don't use a live virus and they can't give you COVID-19. It's a very popular, there's a very important, I think there's a lot of questions about that or lack of clarity about that, but you absolutely cannot get COVID-19 from the vaccine. Because of the name, you might be wondering, mRNA, is this mRNA have anything to do with DNA? mRNA never enters the center of your cells, which is where your DNA is kept. So our bodies actually get rid of mRNA. It does not have much of a shelf life. So as soon as your body's done reading the mRNA, it flushes it. Therefore, there is no way that mRNA can affect your DNA. The 2 available vaccines are around 95% effective. And that means that for every 100 people who receive the vaccine, around 95 of those 100 are immune to the symptoms of COVID soon after they get their second course. So the other 5 could still become infected, but they're very unlikely to require hospitalization as far as we know. So that's a really effective vaccine. To give you a point of comparison, the annual flu shot that most of us get, that's around 60 to 70% effective. So this is a very, very effective vaccine. Some people that get vaccinated do experience side effects. Common side effects include sore arm, fever, body aches, headaches, fatigue. For most people, side effects are really mild. They don't interfere with normal daily activities. You probably by this point know some folks that have been vaccinated. I've heard very little about severe reactions. Severe reactions are really uncommon and the side effects tend to go away within a couple of days, 1 to 3 days usually. There are 2 ways that people become immune to COVID-19. One of them is through the vaccine, and the other is by recovering from the disease itself, which is called natural immunity. And because COVID-19 is a new disease, we don't know how long natural immunity lasts. Evidence suggests it might not last very long, and this is one of these we don't know questions. We just don't have the information yet. We don't know how long vaccine immunity lasts either until the vaccines have been in use longer. Both natural immunity and vaccine-induced immunity are being studied really closely by medical experts. So that's one of those things, right? It's a new disease, it's a new vaccine. Seeing how long the effects last is where there's a big question mark right now. And that'll affect a lot of these other kind of downstream concerns. The COVID vaccination is recommended for all adults, except those with allergies to vaccines, severe allergies, and some immune-compromised individuals. If you have a history of allergies or you have a weakened immune system, what we'd ask you to do or suggest that you do is talk to your healthcare provider to see what they say about how appropriate and safe the vaccine is for you. So vaccine manufacturers started producing small amounts of the vaccine even before it was approved, right? So it's sort of a way of hedging their bets, right? They have a thing, they think that the trials look good, they apply for emergency use, and they start manufacturing it so that you may remember, like the day that the FDA, the Food and Drug Administration, approved these vaccines for use, there was like decent amounts of them on planes actually en route across the country. And that's again because they had a pretty good sense that they were going to work, and so they started making them in advance. But the key point there is that there's a limited supply at first. They can't, they don't ramp up mass production before it's approved. So there's a limited supply at first. And on the other hand, on our end in the state, our distribution is speeding up as we train staff and volunteers and develop and scale processes and perfect the registration and make the registration easier and more accessible. I think we're up to, we got new information today. I want to say we're well over 50,000 doses administered. There's also the challenge that we're a large metro area and a decent sized state that's really, really far away from the rest of the world. And our supply chain is fairly fragile. So we have to have a reserve. If we don't get as much as we thought we were going to get, we still have to get people those second doses. So you may have heard in the news that there's, people are upset or frustrated that there's more doses than there have been administered. Well, some of that is there's a lag in reporting how many we've actually done, and some of it is we have to keep some on site just in case something happens. We actually got less this month or this week than we thought we were going to. So we are continuing to speed up our process. We are hoping that the amount of vaccine, we expecting the amount of vaccine is also going to ramp up. We're also expecting that there's very likely going to be more vaccine. So all this means, I think the key is we are going to continue to increase the rate of and supply so that everyone who wants a vaccine will eventually be able to get it. There is no scarcity of vaccine. There's only a timeline, right? So we don't want anybody to be afraid that they're going to miss out on the vaccine. There's going to be plenty for anybody that wants it. The vaccines have not been studied in pregnant and breastfeeding women and their infants. mRNA vaccines are not thought to pose a risk to those groups, but it can make pregnant women and their fetuses very sick. If you are pregnant or breastfeeding, you should talk to your healthcare provider about whether or not to get the COVID-19 vaccine. So far, no vaccine has been studied in children younger than 16. At this time, one recommended vaccine is for people 16 and older, and another recommended vaccine is for people 18 and older. If it changes, I don't think we're going to see a change to that soon. I think it's going to be a little while before there's any confidence for kids. So I think if there is, you'll hear about it, and we'll let folks know. But so stay tuned. But it's going to be a little bit. For now, we are not recommending vaccination for anyone under 16. So who decides who gets the first vaccine, right? That's a big question. The U.S. Center for Disease Control created a set of general guidelines, so like an umbrella framework for vaccine distribution. And then the Hawaii State Department of Health put together a team of healthcare providers and others to create a list of priority groups based on those guidelines. I want to talk about, there's two different things. I want to talk about the risk categories first, because I think it's really important to start there. And then I want to go through the tiers real quick of kind of what the different phases are and who's in them. So to start with, there's four risk categories. There's four categories that have been identified as things that would prioritize someone for getting vaccinated. The first is risk of contracting. That includes people who work in direct patient care in hospitals and nursing homes, people who handle biological waste in hospitals and nursing homes. So that's folks like doctors, nurses, clinical support staff, cleaning staff. All of those folks would have a greater than average, a higher than the baseline risk of contracting COVID. The second, we talked about it a little bit already, the risk of serious outcome or death if infected. Older adults, we know very well, right? They are, if an older adult gets infected, they are much more likely to have a severe case or to die from COVID. So that would put them in that elevated risk category. Diabetes, hypertension, COPD, some compromised immune system, some immune diseases, put an individual or a population at a higher than average risk. The third is the risk of negative societal impact. This is a little bit trickier to define, and it's something that you're probably hearing some discussion about, but it's folks that if they were to become sick or incapacitated or pass away would have a significant impact on the functioning of society. So that's folks like harbor workers, government officials and key staff, transit workers, postal workers, utilities workers, people that there are not that many of them, and if there was something to happen, it would be really disruptive to the normal functioning of the country or the state. And then the fourth of those risk categories is the risk of spreading COVID-19 to others. And those are congregate living situations is the main example there, right? So folks that are in correctional facilities, folks that are in large households, folks that live in dormitories or live in shelters are all folks that if they were to get sick with COVID would be at risk of spreading that COVID to a lot of other people. So that's your fourth risk category. So once you have those four risk categories defined, you kind of throw all of that into a computer and you decide what those how to weight those risks differently, and you come out with a prioritization list. And I've really tried with most of this presentation to make it visual and to not have a lot for everybody to read, because I think it's more interesting to look at graphics and hear talk than read. But this is where it gets a little bit complicated, and I have to stick with some more detailed information. So we are still technically in phase 1A and just about to jump into phase 1B. We're starting there. Or I guess we're in phase 1B. And phase 1A is healthcare workers and long-term care facility residents. So that's paid and unpaid personnel serving in healthcare settings who have the potential for direct or indirect exposure to patients or infectious materials. There's 40,000 of those in the US. Long-term care facility, I keep saying US, I'm sorry, in the state. Long-term care facility residents, adults who reside in facilities that provide services including medical and personal care to individuals unable to live independently. That's another 10,000. So just in that phase 1A, we're looking at about 50,000 people. You may have seen that we are actually in phase 1B in some regards. There are some people in phase 1B being vaccinated. We are also, I think, at a state level, really focusing on getting as much of 1A done as we can. And if there's some institutions that are in B, that's not bad. Phase 1B, we are again looking at Hawaii residents age 75 and over. That is 109,000 people in the state. So that is a huge population. It's a ton of folks. And then frontline essential workers. And that's workers whose duties must be performed on site and require being in close proximity to public and coworkers, are at substantially higher risk of exposure, and are essential to the functioning of society with special attention to life and safety. And that is estimated to be another 50,000 or so people. Again, that's been slowly ramping up. I think from a state perspective, we're really still talking about being in, really focusing on phase 1A with some phase 1B activity ramping up. Here's some examples of the phase 1B workers that we're reaching out to now and getting vaccinated. The first responders, corrections officers and staff, emergency service dispatchers, individuals essential for federal, state, local government ops, critical transportation infrastructure, critical utilities, teachers and childcare and educational support staff, and U.S. Postal Service employees. Those are our 1Bs. And then phase 1C, we're looking at probably March to get that going, and that's adults ages 65 and up, and then individuals of all authorized vaccine eligible ages with comorbid and underlying conditions that put them at an increased risk for severe COVID. And then also additional workers, additional essential workers that are considered essential but not part of that 1B group. So there's a number of additional kind of factors that I think are important to consider in there. And I mentioned this a little bit earlier. Distribution may occur concurrently between phases and geographically. So for logistical reasons, it's possible, right, that one island could be further along than the other in its phases, right? You have a larger senior population or a smaller essential worker population. This should not concern anyone. Each island and each community has unique strengths, challenges that make some phases quicker or easier. We really are trying to allocate to the islands and to the institutions with that in mind. But if it happens, somebody gets a little bit ahead of another, the real priority is shots in arms. We is our mantra. We just want to get as many people vaccinated as quickly as we can. Another is that we may prioritize geographically in consideration of current disease activity, disproportionately affected communities, and health and socioeconomic vulnerability. So I think the key point there is that if there are outbreaks, if there's concern of imminent outbreaks, vaccination we could refocus and target on specific geographic areas or demographic areas. Vaccination of the general public beyond that phase 1 is projected to begin in early summer. And that, again, depends on production and allocation. And so that's where it gets a little vague, right? That's what we think based on what we have now, but there's more vaccines coming online. We don't have a lot of control over the vaccine production or the distribution. There is some expectation that maybe things will speed up with the new administration that starts tomorrow, offering more federal coordination and support. So that could be really helpful for speeding things up and for getting the whole project moving along even faster. But that's our projection at this point. This one's a big one. The vaccine is free to the public. The U.S. government paid for, invested in the companies that are providing the vaccine, and there is no fee for anyone in the public to be vaccinated. There are some cases where providers may charge an administrative fee, but most providers in Hawaii have agreed not to charge an administrative fee. But the vaccine itself is paid for by the government. How will I know when it's my turn? The Department of Health is working really closely with hospitals, TV, radio, newspapers, community partners like you all to spread the word about availability and schedule. If you're in phase 1A and considered an essential worker, you'll probably be contacted by the workplace. So anybody whose workplace is the reason that they're high tier, they'll most likely hear about it through them. Otherwise, stay tuned for updates from the Department of Health and trusted news sources. We actually do have a portal up. This is like a couple of days out of date. That's how quickly this happens. But there is at hawaiicovid19.com/vaccine. There are registration portals for folks 75 and up to sign up for vaccines. And there's a number of sites that we link to that have their portals set up. So we are rocking and rolling with folks 75 and over. The main process that we are using is called closed points of distribution or dispensing, which are pods for short. So we will be the primary type of event is a pod. Pods are set up in open, centrally located facilities to vaccinate a lot of people very quickly. Pier 2 in Honolulu is one of our pods that's just starting today. It's huge. It's a very large effort. The really key point there is that they are by appointment. We really want to make sure that folks know that it's by appointment and not to show up en masse and wait, because we don't want to have lines of hundreds of people outside and creating crowds and creating risk, especially because this phase is focused on our high risk population already. So there is communication out there. We are pushing it out through all of our channels. All of this stuff is on our website, but I think any help we can get in making sure people understand, sign up via the website and show up no earlier than a half an hour before your scheduled appointment. That's really important. But there's no risk of shortage of vaccine in the long term. Everyone that wants it's going to get vaccinated. I'm going to pause for 1 second while this ambulance goes past. Okay. So after you've had both shots, you will still need to wear a mask and avoid crowds, close contact with other people outside of your household. This is another one of those we don't know yet, right? Medical experts need to learn more about COVID and COVID vaccines before they would change any recommendations in terms of hygiene and social distancing. But we'll let the public know when and if that changes. We hope that it changes soon, but we'll let folks know. One of the kind of key things to look for is herd immunity. You probably heard a lot of talk about herd immunity. And herd immunity is really simply a community as a whole becoming immune to the spread of an infectious disease, either through previous infection or vaccination. And that provides indirect protection to people who are not immune, because it makes it harder for the disease to spread. So this is a little visualization of our blue vaccinated folks and our yellow unvaccinated folks and our red contagious folks. If you have enough folks in the community who are vaccinated, that they are insulating the folks who are not vaccinated from people who are contagious, you can achieve what's called herd immunity, even if those folks, for whatever reason, aren't able to get vaccinated. And that's kind of the big goal here, is to get to the point where the disease is not spreading, not through 100%, but through enough folks that we have collective herd immunity. We don't know, unfortunately, what that percentage is yet. I think that's another one of those. It's a new disease. It's a new vaccine. We don't know how long these things last. And so all this stuff intersects to make it a big question mark. But I think we know a little more every day. We're watching other states and other countries and other areas to find out, to learn more. But as soon as we do have some confidence in that, we'll start sharing it. It is still important to get your annual influenza vaccine or flu shot during the COVID-19 pandemic. The flu shot provides a lot of benefits. It will keep you from getting sick with the flu. It will reduce the severity of your illness if you do get the flu. It will reduce your risk of hospitalization because of the flu. Flu shots are very important to keep you healthy and keep our clinics and hospitals from being overcrowded during the COVID-19 pandemic, but they will not stop you from getting COVID-19. It is not the same. So we recommend that everyone get your seasonal flu shot and also get your COVID shot. It's really, really important. So that's it for the formal presentation part. I do want to direct everybody's attention to hawaiicovid19.com/resources. And you can actually just go to hawaiicovid19.com and then click on resources and then click on multilingual resources. We have a really robust resource library. We have most of our guidance and our documents are really accessible. They're designed to be easy to read and easy to follow for folks that aren't clinical professionals. We have all of the languages. We have 16 languages for most of our documents. So we're really excited about that. We did just add our FAQ. So most of what I just shared is also translated into Oleo Hawaii on the website. I will put that link in the chat. I'm really glad that we're getting very close to having all of our priority languages done, and we have a lot of other ideas coming out, like some video explainers. We've been actually doing some of that already, but some FAQs on COVID and video. But we are, I think, really interested to hear from you all in terms of what you have heard, how you feel about what you just heard, and what more you feel like we could do, and any suggestions you have for how we can better get the word out. So I want to say thank you so much for listening this far. I really, really appreciate everybody's time. And at this point, I'm going to stop sharing the screen and just see if people have any questions or any thoughts on what they've just heard or any suggestions. I guess I'll start with the questions. So I see some folks in the chat, and I'll start with those. I got a couple, and then I'll open up the floor. So the first question in the chat is, what about the particularly vulnerable? My husband has stage 4 lung cancer and only a small part of right lung after surgery 3 years ago. I would absolutely defer to your physician on that. I think that's a decision for a conversation for a physician to give direction on. I think that's much more appropriate than public health guidance. And then any chance of vulnerable folks being pre-65ers? I'm not sure I understand. If somebody wants to clarify that question, I'm happy to take a shot at it. What that means, any chance of vulnerable folks being pre-65?
Yeah, can you hear me?
I do, I can.
Yeah, cool. Hi. Thanks.
Hi.
Thanks for all of that. Yeah, it was just a carry on, because as I was asking that question, you came up with the slide saying the next one would be 65 and vulnerable people. And so that was just my follow-up saying, well, is there any chance of those in vulnerable health situations being listed prior to healthy people of 65?
Yeah. I think those two are similar, if I remember correctly.
Yeah, they're on the same list.
Yeah,
that's
they're on the same list. Yeah. So we'll open it up at the same time. There'll be different channels. I think you'll work through different processes to get on the list, and there's a separate list maintained by, according to whether you're on that older adult list or the vulnerable list, vulnerable medical list. But we're getting pretty close to those.
So are you recommending then, that rather than these general recommendations or the general 1A, B, and C that you're suggesting, that we actually, rather than just wait to be asked, that we do get in touch with his doctor and see if there's a chance for him to get it earlier?
I would ask. I think probably you're going to hear a similar thing to timeline, but again, different institutions and different islands are a little bit further ahead and behind. So I don't think there's any harm in reaching out. I'm a little hesitant to give like specific individual directions or instructions, but I think we've been pretty engaged with our physician partners, our medical provider partners, in terms of timeline and eligibility. So they'll know your situation and the guidance better than I can.
Okay, I just want to say thank you very much, having seen all the chaos that's going on in other states across the mainland, that we're getting information and we know that there's a sort of a regulated way of approaching it, and it makes perfect sense from that point of view. So I just want to thank you very much.
Oh, well, thank you. I appreciate it. There's a lot. It's, there's nothing been done like this ever before. So it is really challenging. It is really stressful. And the federal coordination has been a little lacking, but I think hopefully that's going to change soon. And I think things will we got a lot done in a month. So I feel pretty optimistic that we're going to speed up and get through this. Thank you.
CJ, I have a question.
Hi.
We take care of our vulnerable kupuna. What about those who do housekeeping and are assisting caregiver, part of the family bubble? And that if you're home with a 90 plus or 80 plus year old and doing household work and shopping and doing all the running around, they come home to their bubble. So where do you place those homemaker caregivers who assist the elders in their care? as you give coverage vaccines to the elders, what about their makua, the younger generation who are providing the care, whether it be grandchildren or younger, the sons and daughters?
That is a very good question, and I don't want to give the wrong information. I know that there have been situations where the caregiver or provider that has accompanied the 75-year-old or over to their vaccination has also been offered. I don't know that that's consistent, so I would not want to make any broad statements. I think maybe that's a question for once you. Let me follow up, actually, rather than speculate. Let me write that
Hey,
down and follow up.
CJ. CJ, this is Hi, CJ. This is Sherry. I was
Sherry.
Hi. I watched the news conference this afternoon.
Oh,
that
I
the
haven't seen it.
Lieutenant Governor, right? And so that exact question came up.
Okay.
Auntie Kaala from one of the reporters, and what Director Shar had said from the Department of Health was, from a public health standpoint, yes, that would make logical sense for those caregivers to be also vaccinated with the kupuna. However, same as what CJ said, in terms of the practicality of it, there may not be enough vaccines to make sure our kupuna population is done. And some folks have been and some sites haven't. But she said that's kind of where the consistency, but they recognize from a public health standpoint, good practice, but in practicality may not work out. So that's what she had said today in the news conference. So quite timely.
Yeah, thank you so much. I was too busy. I couldn't watch that today, so I appreciate that you did. So you're going to be deputized if you may have more information, more recent information than I do on some things.
No, I think that's all negotiable. So I think the caregiver needs to ask the question, and who's in charge of supervising that pod might be able to assist them in that decision making. I realize that as we take care of our vulnerable kupuna, there are children who are also with comorbidity, may be at great risk too. So that's why the question.
Yeah, it's a great question. I think that's another thing I don't specifically address in the presentation, but I think it's really important to share that these vaccines, we are coordinating with healthcare providers and federally qualified health centers and long-term care facilities and pharmacies and all these other partners, and they're running their own operations in a lot of cases. So there is not, again, there's some variation in terms of like who's the site rules. So it's probably valuable if there's anything that's in that gray area, maybe check in with the site or reach out to the site or the health provider or the vaccine provider to see what they're doing.
Hi, I have a question. This is Charlene Kasner from California, Orange County, California. And I was wondering, is there a large percentage in Hawaii of vaccine hesitancy? Because we're seeing it here in California.
That's a great question. You know what? We're actually not so bad. We have done an original. We did a survey in over the course of December, and asked exactly that question. And I know that they're polishing off the public results this week, so there'll probably be something published next week, maybe. But I would say my recollection is that there's, we ask in terms of a spectrum, right? Like 0 being heck no and 5 being like you bet, yeehaw. We had a lot of folks. I think 2/3 of our population in general were pretty enthusiastic. We're on the yes or just slightly hesitant, but leaning towards. There was only about 1/3 that were hesitant or heck no. And I think that the important thing to remember there is that was in December. There was less information, and what we're hoping on. I don't begrudge anybody having questions or having concerns or having curiosities, and certain populations have reason to be more or less risk averse. That's fine. We don't want to rush anybody. We don't want to make anybody feel bad. The expectation, I think, is that as we get more and more people who are enthusiastic and who are interested in it vaccinated, that most of those folks that are, everybody but the zeros are going to come around. Not everybody, but we hope that a lot of those folks come around. There is some variation racial and ethnically. Interestingly, there's certain populations that are more enthusiastic. We are actually the Native Hawaiian and Pacific Islander are a little bit more hesitant, probably not a huge surprise, but even that population is above 50%. So there's not, there is some hesitancy, but I think some of that is very reasonable for historic reasons. And I think another part of it, there's a perception we don't want to be experimented on, and that's totally valid.
Right.
And so, and the other part, I think, just based on having done this outreach, is we have not had a lot of information out yet in English, much less in any other language, about process, about how you call or where you go or what you do. And we've been saying pretty clearly in English, like, we don't know yet, but we haven't been saying much of anything in any other language, and we haven't been saying anything directly to these community partners. And so I think there has been an information vacuum, and I think that's what gets you, right? Is like, just when there's nobody out there saying anything, that's when you get hesitance, or you get rumors, or you get hoaxes or conspiracy theory stuff. And so that's why I'm trying to get out there more. And then there's the Vax team or the contact trace team is also out there doing this, but we just want to make sure that we're getting good information out there ahead of people's eligibility. So it's a good question. Well, I think we're better than a lot of the country. I'm really relieved to say.
Yeah, and I think you're absolutely right. As more people are vaccinated and you see less and less adverse reactions, then more people will step up and say, well, so my uncle, my aunt, whoever got it and they're fine. So I'm hoping that more people will go that way. Thank you.
Yes, of course.
Hello, CJ. This is Ualani.
Hey.
Hey, long time no see.
Long time no see. Yeah.
Can you just share a little bit with the group? You've been doing a lot of focus groups, and so can you just share a little bit, like some of your more common findings across, and like how many focus groups you've been doing and the communities you've been into and all of those kinds of things?
Yeah, you bet. So I have been, along with, I don't know if anybody's been on any of the contact tracing Telly Matangi's outreach events, but Telly Matangi is the head contact tracer for the NHPI contact trace group, and she has also been doing outreach and education stuff. And I've been doing two different tracks. I've been doing these smaller talk stories that are really designed specifically to be intimate enough where we can have a conversation and I can hear from community leaders and influencers and folks that sort of have the pulse. And then also been doing larger webinars that are aimed at the general public and more like more of a one-way than a two-way engagement. I think we have done, we've done a ton of Chuukese outreach. We've done a ton of Samoan outreach. We've done a ton of Marshallese, Kosrayan, and the focus again has been, it's not, I'm maybe not the right face to be knocking on doors one at a time and telling people, hey, trust me, you should take the vaccine. So rather than sort of, doing it in that way, and also there's not very many of us, we think that it's really, really valuable to engage with the community influencers, and whether that's church leaders have been a really, really valuable source of information and way to disseminate information. Groups like Papa and the 3R group have been super valuable, and I'll go anywhere. I mean, it's, if somebody has a civic group or if somebody has a church group or whatever, just heading out and giving that quick presentation that I did, and then having the conversation like we're having tonight. I think the short answer to what we have learned is the deck that you saw tonight is the product. Those are the actual FAQs that I got in the neighborhood. So, the department has a 30-page long FAQ. It's very long and it's very detailed. And what I have been doing is, based on what I'm actually hearing, based on what other, we hear from other populations, have distilled that down to kind of the things that people really want to know about, and put it in language that's accessible and also translatable. And it changes a little bit every night. There's things that people don't, there's the new questions that come up. If they come up 2 or 3 times in a row, I go, oh, I need to address that somehow. That needs to find its way into the deck. So it's just this, I think it's the things that you would expect it to be. I think it's, does it cost any money? Does it mean, I think one I didn't specifically address is, does this mean that we're going to have to get a COVID shot every year? That's a really common question. And the answer to that is we don't really know. Like, it's entirely possible that as it mutates, it will become more transmissible and less deadly. There's the theory that's like it could be a cold virus, and it's something that you have to get a vaccine against every year or whatever. There's so much that we don't know. But I have not encountered, and it's probably selection bias. I think probably really hesitant or skeptical or conspiratorial people aren't going to waste their weeknight arguing with me. Although we did Waianae Coast Comp, and that was pretty spirited. I will say they did a pretty good job of moderating the chat, so that wasn't super trolly. But like, there's people that have opinions, and that's fine. Like, I think I can't tell anybody what to think. I can't twist anybody's arm. What we can do is my working theory is everybody trusts somebody for health information. And so we just want to figure out, like, well, here's the populations that are disparately impacted, and they are, and Native Hawaiian population isn't even particularly disparately impacted in terms of the disease. There's a lot of other wraparound and socially devastating effects. But like, from a disease perspective, we're really, really concerned about some of our Native Hawaiian, our Pacific Islander subpopulations and our Filipino population. And like, I forgot what I was going to say about that. But just making sure that we have that we are connected to the folks that are part of that process of decision making. When, like, who do you turn to? I know who I do. It is a church leader, a community leader, a neighbor, a community health worker, whatever. So just trying to push those buttons and trying to make sure that people just know where to go for good info.
Mahalo for that.
Yeah.
Having worked with our Pacific Islanders in Southern California, one of the major hubs are really our faith-based organizations. How many church presentations have you done?
A lot. I would say, more of those than anything else. I think those have been the main, mostly church groups. Samoan pastors, Tongan pastors, Marshallese pastors, done a lot of groups. Yeah.
Yeah, they're centered more on their faith-based organizations, faith-based rather than community. The other thing that I like to see is probably a lot of partnerships with the FQHCs, and especially on the outer islands where there are less of them. If there are smaller clinics they can work with, you'd probably work within the communities, such as in Kau on the Hawaii Island. I think there are 2 FQHCs, but Kau has some smaller clinics, and getting to Kau, where there's a large population of Chukis and Marshallese, is critical to get to that population. And many of them are uninsured. Yeah.
Well, Auntie Ka'ala, just to let you know, and CJ's been part of our COVID response team. So we actually have a PI sub team that focuses on those Pacific Islander groups. So they meet weekly. And then down in Ka'u, we actually partner with Ka'u Rural Health with Auntie Jessie Marquis folks who are already out there in the community doing it. In fact, Jessie just told me today that we have a partnership with Morehouse School of Medicine under NHPI projects, and she's going to be working with them around community health workers. So there is a lot of that kind of stuff happening on the neighbor islands. And then on Maui, they're working with Mālama i Keola, because they do a lot of the outreach too. But that's where Telly, that CJ had mentioned, Telly, who's very integral in a part of the PI sub-team as well as Department of Health, has been kind of coordinating all of those relationships.
Are you working with Morehouse? I understand they have a huge grant, so good. Let's tap into that resource and reach Hana and Kau and those areas that we have concentrated Hawaiian and Pacific Islanders who don't have access to the larger pods, I would imagine.
Well, in Hana, some of these larger Native Hawaiian communities, their representatives, like in Hana, Kalani English has been very active, and Lindy Coit, in getting things out there to them. So there has been in some of those pockets, and Waianae, Waimanalo, those FQHCs have been kind of doing those. And in terms of vaccinations, and it was announced today that the FQHCs will also be vaccination sites.
Great.
So that's
critical. Yeah,
that's a big one. That's actually, and we're trying to work through who's doing what in terms of translation and language access for them, because like the last thing we want to do is have us and every FQHC doing our own Chukis translation, because there's only a few people that can do it, so that just bottlenecks our whole system. So we're trying to figure out, okay, how can we streamline this translation process and make sure that everything's available. and accessible.
Well, the FQHCs usually have the navigators who are already in tune culturally and linguistically in tune. That's great.
And there's a little bit of a wrinkle in all this that I think Sherry knows really well, is that the original CARES Act expired at the end of Federally Qualified Health Center, FQHC. The original CARES Act originally expired at the end of last year, on the 31st of last year, and so there was for last year a mad dash to spend what was a pretty significant amount of money, and there was no clarity, I think, for most of last year what was going to come after that. And so we were, Sherry worked with us on this, and there's a number of other partners that we funded Papa, we funded Hi-Fi to organize and coordinate some community health worker effort, and we really, that was kind of a big part of the ethic, was like, people are doing the work, we just want to pay them to do the work they're doing. Like we don't need to we don't need to be redundant or do additional work. We just think that people should be, they were doing it unfunded because they believed in it and knew it was important. So we wanted to support that. The challenge, of course, was that we were in this mad dash to spend all the money by the end of the year, and then we spent it. And then A, they extended the deadline, but there was no money left to spend because everybody had spent all their money. And B, we don't know. I mean, the state budget is in a death spiral, right? Like there's very little funds. We're really concerned about that and seeing what that's going to look like. But there is some special money allocated for vaccines and for contact tracing and for testing and stuff. And there's also this second round of CARES money that was approved that also has, while it doesn't have direct state money or local money, it has vaccination money, and it has contact trace money, and all that goes directly to the DOH. But there's an interim, like but one has expired and the other is ramping up. And so it couldn't have happened. The timing really couldn't have been worse in terms of COVID communication for vaccines, because this is this really critical period for vaccination where it's really valuable. It'd be really great if we were still under contracts for some of these old contracts, or we already knew what we were going to get allocated to do the coming work. But we think that's going to be resolved here next week with the legislature. Tomorrow, I guess, with the legislature starting. And so we'll have a better sense of what kind of money we have and how we can spend it and how we can support the work. And it hasn't stopped us from, doing stuff like this that doesn't cost any money, and from getting translations done, ad hoc. But I think the organized effort is really unfortunate that the timing worked as it did, that there was this kind of disruption of continuity of certainty of funding.
I think we have to all hold on, because next 24 hours,
at
least the next 7 days, will be critical. Because I've heard FQHCs and fear the discussion at the national level. It does take time to trickle down to the islands, but I'm hopeful with the new change in administration that things are definitely going to rev up. So I hope you're ready for it.
I think I'm being recorded. I'm on the clock, so I don't want to trash the Fed too much. But I think that I don't think you can understate how much federal coordination is going to help. And it sounds like there's going to be a lot of additional federal coordination of the vaccine process, and just the idea of a bunch of states and metro areas doing this on their own. They get it, the federal coordination really stops at the runway, and that's not any way to get this done. And so it's been very stressful, and it's been very frightening. And I really think, I think that of all the things that we're expecting, they'll get turned around in the next couple of days. That's a really big one. I really hope that it goes pretty well, and I think it will.
Are you working with the Hawaiian Home Centers?
I am not directly. If Sherry is, then we are, because we're supporting them.
Sherry? Is there much coordination with the Hawaiian Home?
So yes and no. It depends on which communities you're talking about. So there is coordination with places like Papakolea and in other homestead communities, but not
Anahola?
Not all.
Okay.
Not all, and not consistently. I think that goes back to the involvement of the HHL.
Okay.
And that's also the involvement of the Shaw. And I think, if I'm going to be honest, in some situations, we have to be thoughtful of people's wheelhouses and not to insert ourselves in some of those spaces, because it's not seen as appreciated at times, even though we're in this pandemic. So I think some associations have been active in doing things and being engaged, but not consistently. And there's nothing coming from DHHL around recommendations, mandates, those kinds of things.
Only because I'm a true believer that rather than them coming to you, you've got to go to them. And that's a hub that we shouldn't forget.
No, and so on the neighbor islands, the different healthcare systems have been engaged with homesteads in different capacities.
Okay.
Yeah.
Yeah, it should be on a local, state, island wide. Yeah, it makes sense to have the individual island FQHC working with them. So that's good to know there's at least that partnership. We need to strengthen that as well.
Taking good notes.
Good. Any other questions from anyone online?
I don't know if this is a question, but I was just gonna share.
Good, Malia.
Yeah, I'm connecting from Kauai, aloha CJ, and I think our experience so far with the vaccine, I mean, just personally, is my husband as a essential worker here on Kauai. He just got his appointment made, and then for me, I actually just as we were talking, I went onto the Kauai Gov website because my place of employment is actually on Oahu and for UH Manoa. And we did get a email recently, but I also heard our mayor say that if you didn't get an actual appointment and you're an educator, as one of the categories, then to just go to the Kauai website and fill out their vaccine web survey over there. And so because I don't foresee myself flying to Oahu anytime soon, while you were talking, I went to the Kauai.gov website and I filled out that survey because I'm thinking I might fall through the cracks, since I work there but live here. And so, and I'm just wondering because I know a lot of the educators here on island have already been going to do their vaccines because I've been talking to a lot of the teacher friends and family members. So yeah, I was kind of thinking about that, of how there may be some people like myself who place of employment is somewhere else and then we live on another island, we may fall through the cracks. And so that might be, I don't know, something, a place to outreach to as well.
Yeah, I think sorry, someone else is gonna say something?
No, I was just going to encourage her to encourage everyone to get on the list. Let them, invite you or hold you off, but don't self-select and not apply. And as educators, you're front line.
Yeah, I think that's right.
All educators are. And the concern I have is flying into Ireland, you're at double the risk. So I would say to encourage your colleagues to please sign up. Let the system decide who gets held off. But as educators, please. And Malia, you are so you're involved in so many different ways as a community advocate. I would like to see you covered.
Mhm.
I agree with that. I think I don't know the specific ins and outs of each portal, and that's going to make this a lot harder going forward. Is that there are so many different institutions that they're managing their own processes and keeping them coordinated with us, but also having them sort of go at their own pace is going to be really hard. So I don't know exactly. I don't know what to say other than I think I agree with what she said. Is just be relentless, lean into it. Yeah. Register.
Get in line. Yeah.
Mhm.
I don't think there's going to be a lot of friction. I don't think there's going to be a lot of resistance to. I think we are trying to think of this as a statewide process, and there's a little bit of variation from island to island, and there's counties that have their own roles and rollouts. But I think it's a statewide process. It's a statewide allocation, so it doesn't steal from anybody to have it, to do it there. So just push.
And then just to kind of add to what Auntie Charlene was saying about resistance, in our communities. I know in my circle of friends, we haven't talked about this vaccine per se, but we've talked about other vaccines, and I know that there have been some resistance there, and so it's making me think like to try and facilitate a discussion with my girlfriends for them, and it was mostly for their young ones, right? But I heard what you said about the 16-year-old and stuff, and most of their children are younger. But it's an interesting conversation to have, because I've heard them talk about the other vaccines for babies and for their young ones, and some of them have made that choice not to choose to not get certain vaccines, and so that's definitely, I think, a conversation to be had, especially with a lot of, I think, the younger generation of moms and dads who are, just trying to be that true advocate for their children and whatever they feel is right. I mean, it's a person to person kind of, family to family kind of decision they make. Um, I don't know, like I said, I don't know about COVID or how that has changed for them. Um,
My
yeah.
understanding nationally, both of the current vaccine um, producers are also looking at studying. They have a pediatric component that they haven't gotten the data out yet, but they are looking at children, vaccines for children, and applying it at a lesser dose and a different dosage. So they are looking, both of them are doing studies with younger generation. So right now it's 18 and above, but I think soon we'll begin some hard data and science data on the younger generation. But encourage people to get on and sign up. Let the system decide whether they hold you off. But I believe, and I'm optimistic, that vaccines will be coming down the stream. Federal government will be taking a more stronger coordinated partnership with the states. So not only that, hopefully, CJ, the states will be getting more funds too.
Yeah.
So we're hopeful.
And I want to go back a little bit to the mRNA that I talked about earlier. I think when people hear, mRNA or DNA or whatever, I think it's a little bit, it's easy. It's complicated. The science behind it is complicated. There's a lot of concerns about what things, are they, affecting your DNA? Are they getting into your cells? I think that the main takeaway one of the things that I try to promote and try to communicate is the technology behind mRNA vaccines is actually much more effective, right? That was one of the takeaways is flu shots are around 60 to 70 on a good year. This vaccine is 95% effective. The other thing is it's much more precise. So what I've compared it to is like it's doing surgery with a scalpel versus like a butcher knife. I mean, you really are getting in there in a very, very precise, very targeted way. And that's not only is the safety really, really significant, but there's actually a lot of potential for mRNA now that we've scaled it in this way to potentially be explored for other vaccines. So I think it would not be surprising if over the coming years, because of how quick. And the other thing that I don't think I mentioned, it's actually much quicker to scale up and to produce mRNA than it is conventional vaccines that actually use the dead or inactive germ. That takes a really long time, whereas mRNA vaccine can be spun up, a new variant can be spun up really quickly. So I think that there's a lot of other really exciting, my dog, sorry. I think there's a lot of other really exciting. This is kind of potentially the dawn of a new era of vaccination. There's a lot more than just this thing. So I think it's really exciting to me. I think it's a very precise tool.
Dre, are you still on? I don't see her.
Yes, I am still
Okay.
on.
How much longer do we have?
It's really up to you and how long you still want to go and CJ's availability. So you guys decide.
I'm good till 7. I don't want to keep anybody longer than they want to stick around, but I'm good till 7. What I am going to do is I have gifts for everybody that wants one, the courtesy of our survey partner. We're still considering this part of our talk story. So I want to compensate everybody for their time and the great feedback they've given. So I'm going to put a link to sign up for just a small Longs gift card if anybody's interested. Yeah, but I'll put that in now and we can keep talking. But before anybody starts.
CVS on the continent.
Yeah, there you go. So let me try to find it. Keep talking though. I'm just kind of Google search this thing here.
Yeah, and Walgreens and Longs, CVS are doing the immunizations, vaccinations in small and large care homes. So they're going out to the community. So that's good to know. I don't know what they're doing in Southern Cal. Ua, Charlene, are they involved? Have they rolled out their vaccination program?
CVS, they have gone into all of the senior homes and the senior residences. I have not heard that they have opened it up to the public yet at CVS, Walgreens, or Rite Aid. But it's supposed to be, the last I heard, they were trying to get it rolled out by the end of January. But you know how the schedule is, everything just changes all the time. So they say the end of the month, it might be sooner, it might be later. But I have not seen, I was just at CVS the other day and they did not have any of the vaccines ready for the general public.
Yeah, they're doing, I think, the smaller care homes.
Yes.
Yeah, and I think that's a priority, which is good.
Mhm.
Do we have a couple of vaccination dates for Southern Cal?
So in Orange County, it's actually been like CVS pharmacists who have been coordinating for vulnerable populations, for the API population. So there have been 4 so far.
Yeah.
2 that have happened at the Chinese Senior Center, and 2 that have happened at the Vietnamese Freedom Center and Hope Center. So that's where I'm thinking that's where they're not advertising it at the CVS, but the pharmacists are putting it towards these populations based on instruction from the healthcare officer for
Yeah.
Orange County to get to these vulnerable populations and
Think we can
seniors.
get Garden Grove Church, Samoan Church?
Well, so testing is more, vaccination is more tricky than testing and requires insurance. So they have, unless it's these pharmacists that are willing to take this show on the road to certain locations and absorb the insurance responsibility of all of that. We haven't had a chance yet to schedule anything at a Garden Grove, Samoan churches, or any of those yet. We're looking around for opportunities, but there's a shortage, honestly, now of vaccine. Yes, and so people are all scrambling and shuffling big time to find slots and to find locations that they don't have to stand in line and wait for 3 or 4 hours.
Yeah, that's why the smaller churches would be better, and Garden Grove sort of centrally in Orange County. That might be something you may want to talk to your task force.
So that's why these been kind of hush-hush scenarios that have gone on, because each of those events have distributed or done about 250 shots per average for a 4-hour event.
Okay.
And so, like I said, they've been kind of hush-hush, and it's kind of word of mouth, you know, to get to these seniors, these 75 plus. Now it just opened up to 65. So we have an event actually this Thursday.
Right. What we also found was, what we also found is that we have to give all the information on each person prior to registration. And this week, like Ua said, this week they opened it up to the 65 plus. Prior to this week, you had to be 75. And there were days when, and we were blessed to be a part of it, PIP, where they did the community health workers. So we were able to get, you know, our vaccines through that. But they're very, very strict about looking at the requirements, and it has to be Orange County. Each county up here seems to be different. Very interesting.
Yeah, LA and Orange County. Let me try and find that pharmacist that did our flu shots at our last festival. Let me look her name up. She'll be senior
was she
director.
CVS? Was she at CVS?
No, Walgreens.
Oh,
Walgreens on Beach. Yeah, so that's a pretty large Walgreens. Let me find out. I'll look her up and see if I still have it here in Hawaii. If not, I definitely have it in California. I'll try to get that to you. You may want to ask her directly.
And
You
more
know, they've
concerned.
opened. No, go ahead, Ua. No, you
No,
go
I was
ahead.
just gonna say, I'm starting to hear more and more concern in Southern California with regards to like all the major sites that we're doing testing now are all converted
Yes.
to vaccination. And
Yeah.
so people are like, so what do we do about testing now? And so there's a big push for saliva kits, at-home saliva kits
Oh,
being delivered. So I just was wondering, CJ, what does that look like Hawaii wise? Maybe you guys aren't there yet to be talking about this kind of switch over from testing to vaccination, or you guys are not closing any of your testing to accommodate vaccination.
I have not heard anything to that effect. I do know that we're working on an application process for hosting your own pod. I think that's kind of exciting news. So like if a church group or community group or whatever wanted to host something, there's in the next couple of weeks they'll have a way to do that. I think I have not heard anything that there's a capacity issue with the test sites. That's not to say it isn't happening, but it hasn't come across my desk. It's a good question.
Yeah. So
We're like an order of magnitude less trouble than Southern California is for, thankfully.
But there have been a chain of, it kind of follows suit eventually, right?
Mm-hmm.
That these things come to happen, in Hawaii, a day, a week, a month later.
Right. That's true too. Yeah, that's a good question. I can look into that. Write that down.
Mhm. They now have Disneyland available
That.
for
How about
Disneyland, Knott's Berry
Knott's
Farm,
Dodger Stadium.
yeah. So all the big venues that were the huge super sites for testing are all now converted to vaccination, and so
Wow.
people are like, we still have to test to understand who's out there, and
positive, right?
yeah, there's a lot of discussion around that.
And the wait is hours. They wait hours and
Oof,
hours.
I bet.
See those
one of
lines.
the Loa seniors went and took her 3 hours.
Oh, Auntie Ka'ala, we had 3. Was it 3?
Yes.
3 of the Aloha seniors on Saturday? Yeah, last Saturday went, and they were so lucky because they came toward the end of the was that around noon, I guess.
Mhm.
So they came, and because of the timing and everything, they had lunch.
Oh,
That
at
worked
Disney-
out really well for them. Yeah.
The site actually got a food donation, so they were feeding the volunteers, and so they actually got fed, and so they're telling everybody, oh yeah, this was a wonderful site because we got a goodie bag, we got fed. I'm like, do not consider that the standard. That is not the standard at these events.
Exactly. But
Writing this question down. That's a really good question.
any other questions from anyone else?
I think there's one in the chat from Malia. She wanted to know what an FQHC was.
Oh,
I think I answered that, but it's Federally Qualified Health Center.
and on Kauai?
There's only one on Kauai. The one on Kauai is both a FQHC and a Native Hawaiian healthcare system. So that's Ho'olalahui.
Hello.
And
Is
please
that
say aloha to Kapono from us. He worked with us when he was at SC, so we think of him very fondly. Please go by, say aloha.
anywhere near you, Malia?
No, they're in Lihue and I'm in Hanapepe, so about 30 minutes away.
Ah.
So I haven't interacted with them much, but I should make it more.
So,
I
Malia,
try to learn more about their programs though.
So Malia, they have a clinic out in Waimea. They do a lot of the Ni'ihauen patients out in the Waimea clinic. So they have Waimea clinic, Lehui is their pharmacy, and then they have a Kapa'a clinic by Mahelona.
Okay, yeah, I have seen the Waimea one because my OB is over there, and I see the office area, but I've never visited or anything. But
Okay, your kuleana is to go
No.
and say hi to Kapono for us.
Hikino. Hikino. Thank you for
Any
all
other
of this
questions?
information.
I put the link to the gift in the chat. That's the Google form there that I just put in. I really, really appreciate everybody's time. I think this was really great and really valuable. I hope that it was good use of everybody else's time too. And if you have any other groups, if you participate in any groups that would benefit from that presentation that we just gave and some time to ask some questions, please let me know. I've been doing it a lot. It's always changing, but I'm happy to continue to do it. And I really, really am grateful for everybody's time tonight and contributions, I should say.
Great, Dre, this will be online. When would you expect this to go online with the association? Oh, I guess we might have lost her.
I'll work with her, Auntie Kaala. Cause
Sorry, I'm back. Yeah, we just need to download it and then upload it to the website.
Oh,
yeah,
okay.
and Dre, I was gonna say during the workshop time, I ended up setting up a YouTube channel for civic clubs, and so we can add it there.
Fantastic.
And then embed it on the website.
Okay, but let them know if they contact CJ, they can get a more personal discussion. And I think he would probably prefer smaller groups. So I know a group. I'll get you engaged with Hawaiian Civic Club of Honolulu. Yeah, we'll get you out here. Mahalo, CJ.
Yeah.
Thank you all. Thanks
Excellent,
everybody so much.
excellent.
This was really great. I
Thank
appreciate
you.
it. Take care.
Mahalo,
Thanks,
CJ.
CJ.
I'll be in
Aloha.
touch with you tomorrow.
Yeah.
Okay, aloha.
Aloha, everyone.
Hello.
Aloha.
Mahalo. Kōmike
Aloha.
Mālama ola.
Yay, Kōmike Mālama ola.
Aye.
Yeah, look at a backdrop. Awesome,
I
Auntie.
know, Auntie. She rocks it, man.
official.
We'll send it out to all of you. Okay, stay safe.
We hope.
Ahui ho.
Thanks, Dre.